my background is I have a bachelor's in health science from Northeastern, and then I went on and did a master's in public health at Northeastern. I did the two programs separately. I completed my bachelor's and then went for my master's degree. The foreign one wasn't available when I was going through, but I liked having to do the two separate pieces because it gave me more time to explore. I kind of found public health because I was interested in law and policy, and I needed a context to kind of connect law and policy to, and health became that, force for me. So I kind of went forward, and then my interest merged into program design and program evaluation, so how to actually put research into intervention. And at the same time, I was still interested in policy, but what I found myself more interested in was negotiation of stakeholders. And so my job now is connecting the community to research and protecting both the academic medicine partner and the community health partner in merging their interests, as well as creating some kind of intervention to better suit a population that is vulnerable. So Upham's Corner, where Rory works, is one of our health centers. And so frequently I'll work with Rory or someone in Rory's position to gather data and to hear from them. They'll technically represent the health center, and then a researcher will represent their institution, and we kind of merge the two at the table. So I'm often the in-between or the bridge between research and intervention.
That's where I'll start. So I guess I should start this by saying I'm still learning what I want to do when I grow up, because one of my jobs is as a grant manager at this community health center, and then part-time I'm also a clinical data consultant, basically helping pharmaceutical companies manage their data. So it's two completely different worlds, and I like both of them. So I can speak probably more to the health center job, and then if you want to ask questions about the data job, that's fine. So I moved to Boston 3 years ago. I sort of knew what public health was, but not really. So to me, I'm really impressed that you guys are in this room listening about it, because I don't think I knew what it was when I started the program concretely. I knew that I studied psych in undergrad, and I didn't want to be just one counselor helping one person one-on-one. I knew that I sort of needed to look at the population down, but I didn't really know formally what that was and where I fit in. So when I started the master's program, I was really anxious to get out in the working world, just because Boston really is like a mecca for public health, as you guys know, and you get to experience every day, which is great. And by chance, I found out about a job in the community health setting in Jamaica Plain. I had no idea what I was diving into, but I got to work for an obesity intervention that was funded by Children's, and that was really eye-opening to sort of take what I was learning in school and then see it in real life, because I know we talk about, social determinants of health. Well, what are they? They're race, ethnicity, poverty, neighborhood, violence, all those things. So that was the first time I really worked with people who, they embodied what I was studying in school, and that really sort of fueled my experience as a student, and then since in my professional life. So one of the pros and cons about public health that I've experienced anyway is that a lot of the jobs are grant funded, which is great when the grant still has money, but at the end of it, even if it's a successful program, sometimes it can't continue. So I've kind of had maybe 5 or 6 jobs since I lived here, just sort of hopping around, which, in this economy can be tough, but it's also good because I think you find that no matter where you work, like Drew was saying, you can sort of find a bridge, and everything is public health, and you can take your experiences from one job and bring it to another. So currently, I work in the community health field, and I had sort of helped academically write some grants in the past, but I had never been a grant writer at a community health center. So when I started this job in September, it was very eye-opening just because the community experience of public health is very different from what you see in academia or what you see in research. And I think it's really important that you think of sort of where you see yourself, but how you need to be able to relate to others, just because there are a lot of silos in public health where people are doing the exact same activity to address the same problem but never communicating. So I think CHEERS, since you guys are Northeastern students, is a great organization to sort of find out more about, because CHEERS is really trying to break down those silos and get people to work together.
I like to describe it that in healthcare, across the country, but generally in public health, the left hand does one thing and the right hand does another, and they never come to the middle. And so what organizations like mine does is try to pull people with similar interests and different points of views to one table to talk about an intervention that pulls all of those interests together. And so that can be I like to say that it's a challenge. It can sometimes feel like an extraordinary challenge because you are pulling people from such different perspectives that coaching them to meet in the middle sometimes is a very long and arduous process. And when you're putting together a grant proposal and you're on a strict timeline, you don't have time to kind of pull out those things together. It's funny, Rory was talking about the economy and kind of this piece about, yes, positions are grant funded. What is interesting about public health as a field is that depending on what you do, there was never a huge amount of money in any of these programs. So all of these programs are used to doing a lot with very little. And one of the pieces that I found is that in this economy, part of the reason public health programs are so resilient and sustainable, the ones that are lasting, is because they were used to not having very much. So there wasn't a lot of luxury to your position. There wasn't a ton of overhead. And what you're finding is that they were just better prepared to not have access to the same resources. And merging, I work with a number of private institutions as well as public, and you are noticing that the shift from private institutions appreciate when you have an understanding of what it's like to work with nothing. So when you move into a position that gives you a larger budget, you're a little more thrifty about how you're spending it and the work that's involved in those things. So there's a definite, ebb and flow to the economy issue because, yes, there are limited funds. At the same time, there wasn't this exorbitant amount of money, but now you're working with nothing. So it is definitely an interesting piece, and the piece about public health is that you can find yourself getting interested in a wide variety of things. I'm a health education specialist, and that's how I found my job, was because I began consulting for my organization on how do you create program design and how do you work with patients so that they can understand materials on health education interventions. So I did a lot of literacy consulting, talking about how to physically write something so that it's understood by just anyone. Someone with a low English capability, someone with a low education level, to kind of create messages that were emanated throughout. And so I'm lucky that I get to do both of those things at the same time. I get to have tough negotiations and manage budgets, and at the same time I get to kind of explore this design, creative process of, what's a new intervention that we can create. So that's kind of the piece about CBPR and working with the community health centers, is that public health gives you a lot of opportunity to do something new.
I was just going to comment and pick up on a couple of themes. One was the large interest in international health. And before I came here, I was the Associate Director of a Masters of Public Health program, but I directed the Global Health track within that program. And honestly, over the years, I felt my job was to convince people not to do it. And I'll tell you why. Because it kind of comes back to what you've heard sort of in terms of the day-to-day activities, that it really comes down to what's in your toolkit, what's your skill set. When I would talk with students about, tell me your life vision, a lot of people wanted to spend some time overseas, but when I said you want to be, partnered, have a family and living overseas, that wasn't always the case.